Welcome to our community seminar today. Today we have Pastor Morgan as usual, and we have a guest from Kenya joining us from Kakamega. Is Mr. Reuben Nyangweso. He's a community pharmacist, and we are going to be discussing how Africans and Black Americans and African immigrants view the vaccine, and how we as the people who are involved can make sure that people get the right information, and that when the vaccine is available, we can get it to them at in appropriate times and places. So first, we welcome Reuben. You are the guest on the show. Introduce yourself a little bit, and then we'll go to Morgan. Then we move on from there.
All right, thank you, David. As you heard, my name is Reuben. I operate a community pharmacy, which is right in the rural part of Kenya in Kakamega. Just beyond the community pharmacy, we also have integrated services like a lab, family planning. We do lots of clinical services, more so on tropical diseases like malaria and other infectious diseases that are common within this kind of setup. So I'm glad to be in this webinar now to really hear firsthand from people who are right on the thick of things at the US, and then I will also chip in with what I think is the situation in Kenya, particularly in rural Kenya. Thank you.
You are welcome, Reuben. Pastor Morgan, just 1 minute. Pick yourself. Tell us about the New Life Foundation recovery, and actually, I'll push you a little bit, because you are a registered facility, and we have to vaccinate 7 billion people on this earth. So every professional will have to pitch in. How do you see yourself pitching in?
Dr. Amakobe. Reuben, it's nice to have you, and Dr. Amakobe, it's nice to be here today, as always. To our audience, it's nice to be with you again. My name is Morgan Ikonne. I am the director of New Life Foundation Recovery, which is located. New Life Foundation is registered, certified, and licensed drug and alcohol and mental health treatment services here in the state of Delaware. We are championing the cause for Black, Indigenous, and people of colors as it relates to the issue of vaccination. Our hope is that our people
Pastor,
get on board.
Your voice is going and coming. Your voice is.
Our voice is going and coming.
Yeah, your voice is going and coming.
Yeah, it seems to be losing.
Okay. I'm not sure why, but let me. Is it better now?
Yeah, it's better now. It's better now.
I think it was the earphone. Maybe it's now we're connected. So, as I was saying, New Life Foundation, we are truly engaged in helping Black, Indigenous, and people of color understand the necessity for mental health treatment and substance abuse treatment, as well as creating a lot of awareness and sensitization as it relates to this COVID vaccination and COVID itself. We are looking forward to playing a major part in the provision of vaccination, hopefully to go through the registration process with Delaware Department of Health and Social Service and Human Services to focus and target on our population, thereby creating an optimal realization of the CDC and FDA intent to get people vaccinated. And that's who we are, that's what we'll do. And hopefully during this conversation,
Thank you very much for the introduction. We're going to come back to you. We're talking about COVID-19 and vaccination. But first of all, I want to hear from Reuben. What is the opinion on the ground now in say in rural Kakamega, in rural Kenya? Do the people think COVID is real, or do they think that it's something happening elsewhere?
COVID is real by any standards in Kenya. There's been a lot of realization that this is actually an existing disease, because we have lost people. We've seen people admitted. There are those who come out of hospitals. So at least every homestead knows somebody who has had an encounter with a COVID patient, or actually a number of people have lost loved ones and people who are close to them. So in Kenya, particularly where we are in the rural part of Kenya, it's actually real. Having said that, right now we're still grappling with just how to manage the cases that are there. The facilities are wanting. As we speak now, you know that there is a crisis in the means of health in Kenya. Doctors just called off their strike the other day. We have clinical officers who are still on strike. We have nurses who are on strike. So that even with a few facilities that we have, Kenya is overwhelmed. And then the situation has been made worse by a dispute regarding the doctors. They think that they're not getting PPEs, or if the PPEs are there, they're not being distributed well and they don't come on time. That situation has been made really critical to the extent that people are not thinking now about vaccination. That's a call too far. We have not had a proper plan from government telling the people that officially this is what we're doing, maybe in terms of timeline and in terms of quantities and in terms of prioritization. Other than what we see, maybe on the press, but somehow there will be some doses that are likely to arrive early in the year. It means that out of, because they're talking about 24,000 doses, 24 million, 24 million doses. And you know, Kenya has a population of 50 million. So we are yet to know how this will even be done. So people are not talking about it. They're not talking about it, not because they don't think it's there, not because they don't like it, or not because they don't believe in it, but it's because it's actually, it may turn up to be a luxury to most Kenyans. People will not afford, and they may not be anywhere near in the line to get that.
You know, Reuben, COVID-19 is such a disease that unless everybody is safe, nobody is safe. So the point, the fact that a few people may get vaccinated, it does not mean that the rest of the people who are not vaccinated shouldn't be vaccinated. What I would like to know, what we'd like to hear from you is, the simple things like social distancing, wearing masks, wearing masks, social distancing, and washing hands, just generally sanitization. Those are the simple things that we ask, the behavioral change that we ask people to engage in. Are we able to get those done, or is it a bridge too far?
David, to some extent, given the way things work in Africa and say in Kenya, people have tried to keep the protocols. They have tried to adhere to hand washing. They've tried the social distancing, and they do wear masks. However, it's not to the level that you would expect. Take a case where people go to an open air market, say almost every week, and you would find that there are about 4,000 people, and out of the 4,000 people, possibly less than 10% could be having masks. And those masks, to me, they could actually again be a health risk, because somebody may use a disposable mask for more than a month and just carries it around to try and beat the law, because it is illegal not to have a mask, but it is not illegal to have a dirty mask, I would say. So they are there. People try, but we have a limitation. What can actually be done?
Now, Morgan, what do you think? I mean, we have a situation whereby in Kakamega, people are trying. They really want to wear a mask. They want to do self-distancing, and they want to make sure that they are wash their hands. But they don't have the resources to do it. And we have a situation in the US where we stay, where we actually can be able to afford masks, we can be able to afford self-distancing, we can be able to wash hands every day. But we have a situation where people are saying they are free to do whatever they want. How do you relate those first?
I am going to begin by saying that I'm really, really moved hearing the things that Reuben is stating to be facts on the ground in Kenya and in Kakamega where he is. And I think that is a fact that runs across African continent and most of what supposedly they call third world countries. The lack of resources is a very big issue when it comes to public health measures being implemented. Political insensitivity of the leaders being unable to understand that receiving aid and support from World Health Organization and various world agencies, and they ends up not utilizing it for the purpose, truly is hurting their constituents and destroying the very intent to curb and to remediate this virus. To that end, I want to say that I'm going to take a different approach. This is a world pandemic. This is not a regional pandemic. This is not an American pandemic. This is not an African pandemic. If there is no universal approach and leadership in the highest echelons of leadership, this thing is going nowhere. I'm not a bearer of false news and evil news, but that's the truth. We live in an ecosystem. Whatever goes on in Kakamega is going to find its way in Nairobi. Whatever finds its way in Nairobi is going to find its way in Washington, D.C., or in JFK, or in any. So we are all interconnected. So the idea of lack of leadership or a comprehensive approach that is empowering people who are within the rural areas where these needs are more profound is really a negative, it's very negative because it's not going to help the situation. So my hope is that somehow World Health Organization and various international organizations and humanitarian organizations begin to find ways to rechannel their resources to the rural communities and partner with rural community leaders and rural community agencies that know their people, can talk to their people, and convince them. How can somebody wear a mask for 1 month? That in itself is just, it's wrong, it's bad, you know. And the person is not wearing this mask for 1 month because he want or she want, or because they cannot afford buying and changing disposable masks. And I mean, for goodness sake, it is so unfortunate that there has not really been a comprehensive attention that has been given to this virus. This nationalistic approach is not going to help to stamp away this virus.
Pastor, we had a situation like that during the Ebola time. If we had approached this the way we approached Ebola, so that we knowing that wherever, if Ebola exists in any one spot, it will exist everywhere. Okay, so I think that moving forward in the new year, just like we are talking to Reuben in Kakamega, we will be able to engage every health leader all over. We will bring somebody in Nigeria or somebody from Ghana, so that we have a comprehensive, because you know what, there is nobody, if we don't do it, there's nobody who's gonna do it. You understand? The idea that World Health Organization or the USAID or the American government is going to do, American government doesn't do anything unless the American people tell it to do it. You understand? And since if people in Kakamega are not safe, people in Middletown are not safe, because at one time somebody will move across and bring it. So what I'm thinking is, now the US has moved from social distancing, wearing masks, making sure hands are clean and stuff like that, to now having a vaccine. We also had a situation whereby Black, Indigenous, and people of color in the US have been slightly resistant, but they are moving towards it. Yesterday we had a meeting, and I could see people talking about the hesitancy and the reason why the people are hesitant, because of historical reasons, but people are moving on. What I want to see is, how can we, given the challenges that say rural Kakamega has, how can we, sitting here, be able to work with them to make sure that they move forward and we can be able to get the vaccine to them when it comes, so that everybody is ready for it, like during polio time?
I think that's a very good question. And I think what we're doing now and what you had elucidated in your lineup to the question is important. You and I are not in Kakamega. Reuben is. He understands what is currently going on there. He understands the fears. He understands the challenges. If we're going to be effective, we have to continue in this level of engagement, reaching to community leaders where they are, and foremost, finding out what their challenges are and what the situation on ground is. Impository intervention does not work in this setting, because when you impose things and intervene in situations that you're not familiar with, you miss everything. So I think foremost what we're doing is very important. Secondly, those of us who are privileged to be out here in the West needs to start an immediate mobilization in terms of how can we come together to create both the awareness and push for the resources necessary to empower, for example, Reuben and those in Kakamega to be able to be in position. Now, the vaccines that we're talking about, both of them require constant electricity and a level of refrigeration that may not exist in Kakamega or in some part of Africa. So these are logistics that conversations needs to be had around to ensure that people in these rural settings have these setups in place before you are talking about sending vaccines to them. Now, we're not going to go beyond, we're not going to just do that without empowering them through